Welcome, everybody, to another episode of Inside the Psychopathic Mind podcast. Again, Jason Smith with Carl Giacono. And
Jason,
today, hey, Carl, how's it going?
pretty good.
All right. So today we have a special guest from all the way from Denmark, Michael S. I'm not going to pronounce his last name, Michael S. is
Yeah,
a.
I'm happy to be here, and I can just say that that last name is not good in English. Actually, my dad, whose name is Ole, he went to a conference in the U.S. one time, and they introduced him as Mr. Old Shit in front of 500 people. So let's not go there.
Yeah,
Yeah,
we didn't
we'll
want to
just
go
go
on
with the first
record.
name.
Yeah, we didn't want to go on record introducing you that and being accused of something,
No,
Michael.
we
No,
we
not
keep the
at all.
language clean here in the podcast.
Yeah. Yeah, only when we're talking about the psychopaths do we maybe change up the language. All right, so Michael again is from Denmark. He's a clinical psychologist, 20 years working in forensic psychology. First 10 years in a secured prison with a whole bunch of personality disorders and psychopathy, including a special ward for Greenlandic inmates. Those were crimes committed in Greenland. There wasn't really any secure prison, so they brought him over to Denmark. High in dangerousness, and again, indefinite prevention detention in Denmark. He'll probably talk a little bit about that. And then the last 10 years, he's been in the Clinic of Forensic Psychiatry in Copenhagen, doing some pretrial psychological assessments, including, risk assessments with the PCLR and the Rorschach and the PAI. And then from 2022 to 2024, he was in the first secure prison in Nuuk. Is that correct? Nuuk,
Yeah,
Greenland. All
Nuke.
right, Nuuk. Okay, and again, sex offender project. And Michael will come on for another podcast to talk a little bit about sex offenders and some of his research that we're all kind of working on together. But thank you again, Michael, for coming on. And I guess the first question we'll start off with is just kind of talk about a little bit about the psychopathy that you work with in Denmark.
Yeah, thanks
Yeah,
for
I
having
just
me.
want to say, Jason, I want to add that it's such
Yeah.
a pleasure to have Michael on. Some of the things he's going to talk about has helped to expand our thinking on the subject, because sometimes I realize when we're just dealing with psychopathy in the US, basically, you can kind of get locked into certain ways of thinking about it. And sometimes that can create questions that are difficult to answer. And actually, the information Michael will have for us will help answer some of those questions, as well as, of course, the three of us share the interest in the Rorschach, using the Rorschach in psychopathy. So it really is nice to have you on, Michael.
Well, it's great to be here. Thanks for having me. Yeah, so I've been working with the PCLR for the 20 years that you mentioned, Jason, and the Rorschach for probably 15 years, very intensely the last 10 years. And the way we use it where I work now, the PCLR is typical in these indefinite preventive detention cases that we have to make sort of a risk assessment about whether that's necessary or they can just get a punishment that is based on 10 years, 15 years, whatever. So we use the PCLR there. And what got us talking, the three of us, is that in Denmark and Europe, sometimes people use a lower cutoff of 27 or some places even 25. And that got us kind of thinking about like, what's that about? And I'm a little bit critical of it myself, which I think struck a chord with you, Carl, especially.
Yes. Well, Michael, tell us a little bit about how things, in a way, you're going to tell us about how things are, but in a way, it's how things are different than they are
Mm.
here. So tell us about, with using the PCLR and the culture there, how it's different.
Yeah. Well, sometimes I think when you look at Denmark, a population of around 6 million people, and we have this social democratic welfare state that I think sometimes kind of catches people and children especially before they start to continue too long down that really dark path that can lead to psychopathy. So sometimes the very serious problems before the age of 12 is pretty rare in Denmark. I think I've only seen it like a handful of times in 20 years that you really have kind of these serious offenses where the police is involved before the age of 12. Sometimes you would say some of the parasitic lifestyle is maybe not as necessary in Denmark because we have people can get money, apartments if they don't have a job, and they don't exactly always need to kind of latch on to other people to survive. And also, we talked a little bit about some of the more promiscuity, which is not obviously on the factors, but which in Denmark, people are critical of the way that it is scored according to the manual, and I think it's to do with a more maybe liberated sexuality in general. Denmark was one of the first, actually the first country to free the porn back in '68. Where we released that so people could watch it wherever, and people came from all over the world to see what that was like. So some of the things, there are some important cultural differences, I think.
I'd like to get to the individual items in a minute, but what you're saying so far is there's more structure and supervision something there, in Denmark. In fact, it sounds like a more, if we can use the term, homogeneous culture compared to U.S.
I think definitely yes, because obviously your country is less old, and pretty much, aside from the native population, consists of immigrants from all over the world. Whereas Denmark is an older country that has definitely a more homogeneous structure. But at the same time, also we have immigration from Middle East, Europe, Africa, which makes it more of a different kind of cultures that get involved, but not in the same melting pot as everybody says, about the U.S.
PCLR in assessing psychopathy related to prevalence of psychopathy.
I missed the first part, Carl. Sorry, I think you.
Yes, do you tend to find, if in what you envision in the U.S. and what you read from like research articles that Jason and I and others write, more or less psychopathy in Denmark?
I think definitely less psychopathy. I think I've seen some of the worst cases, or the most dangerous psychopaths, and they can definitely score even 40 points, but usually 38, 39, 37. But we just have fewer of those in Denmark. I mean, it's much rarer.
Well, this is what strikes me when Jason and you and I discuss these kind of issues, because you think about in the U.S., the prevalence rate of personality disorders is somewhere between, I think, 9 and 15%. And the global rating, it tops off about 10%. And in clinical populations, personality disorders are, maybe up to even to 40% or more that they're diagnosed now. And one of the things, the increase in the diagnosis of personality disorders in particular is between the ages of 18 and like 26. And the disorders that you see are narcissist, borderlines, and paranoid personality disorders. And the narcissists and borderlines are on that cluster B. So in this country, it's kind of a melting pot of kind of a cesspool for personality disorders. And you see this in some of the public behavior, where you'll see people who base decisions, important decisions, on emotions rather than thinking. They're unresponsive to new facts coming into their sphere. They project their hatred onto others, and they're able to maintain completely distinctly different perceptions without cognitive dissonance in their thinking. In other words, I'm for women's rights, but I'm going to protest for these people over here that do these horrible things to women, and that causes me no dissonance. Personality disorders and patterns are classic borderline disorders. So I did look up Denmark, and you tend to have less personality disorders there.
Definitely.
So given that antisocial personality disorder, which the majority of people that meet the criteria for psychopathy also meet that, is more prevalent here. It kind of makes sense. What I throw out in my mind, Michael, it's a concern, is you think about in your more structured, controlled culture over multiple generations versus here, this cesspool kind of things that go on. How does that affect the genes in the gene pool? It seems like in the U.S., we're going to continue to have these problems and more of these kind of issues that have personality disorders in general. Almost you would think genetically in your culture, over time, it would breed in certain characteristics that are reinforced and shaped.
Yeah.
Now,
there is a funny story regarding that in Denmark, actually, which is kind of a microcosmos of what you just said, Carl. And I don't know if it's true, but I heard it on a PCLR expert course, which a guy was teaching, a friend of mine actually. And he says that, 100 years ago, there's a small town in northern Jutland where the chief of police from a much larger town used to send all the criminals. And there is just a significantly higher crime rate in that town today, 100 years later. So that kind of maybe has been a little bit of a genetic cesspool of criminals, which gives all kinds of reminiscences of the British ex-cons going to Australia.
Australia.
People who immigrated to the US, maybe also some of them were criminals from Europe and stuff. It is interesting. Also, I think the genetic side is one thing where there might be differences. And obviously, the construct of psychopathy is both genetic and socially determined. So it's fascinating.
Yes, an interesting point. So you're assessing psychopathy there in Denmark and Greenland. Some of the items you find kind of are a little bit different or questionable. Can we talk about those?
Yeah.
The items.
Well, if for one is that we already kind of discussed, and which I think is really important here, is that kind of glibness that is a little bit less common in maybe Denmark, because we're a little bit more of a restrained types. Maybe not as much as the Finnish if we go into the Scandinavian comparison, but still compared to the US. Where it's very rare we get this kind of press conference syndrome that is mentioned in the PCLR on the glibness.
And I want to ask you a question about that, because obviously we heard about that with David Cook's research and stuff historically. The question I have about it, and it is the one item that I think, there may be something to that after myself having taught in the Scandinavian countries and so forth. But when you get somebody that's 36, 37, do they manifest glibness even if they're Danish?
Yeah, they do. I think that's not. We definitely get some that have the glibness, and I can remember several cases of people just, they walk in and they just own the room immediately, and you think, well, you're being evaluated for a possibly life sentence for homicide, and it's like you're talking to your fans at a at a press conference. So when we get those that score above 35, I think the glibness would usually be there.
We want to make that as a footnote when we get to talking about the idea of lowering the score. So it does exist there. It's less.
Yeah.
And much less.
It's just a much more restrained culture where people don't kind of boost their egos maybe as much. I mean, that's a theory that people...
Yeah.
I remember I had a very interesting psychopath from the US that came to Denmark and was incarcerated here. And he basically, because we kind of discussed psychopathy, he basically said, well, I think I'm just more of an American than a Danish person, because we don't tend to preserve our egos in the same kind of way that other people do. So I don't know, it's just an anecdote, but still, I think there's a cultural difference there.
Yeah. Well, what were you going to say something, Jason?
Yeah. Also, Michael, what about the criminal versatility? How's that different in Denmark, you think?
Yeah, good point, Jason. I think when we get the high scorers, obviously they will have that as well. But sometimes, we tend to catch criminals earlier on in Denmark. We almost don't have any serial killers, which I think is to do with the very high rate of solving crime cases in this kind of small community where we have social security numbers, everybody's registered somewhere, and we have a large DNA register as well, and all these kind of things that makes it easier to catch people and harder to get away with, 3 or 4 murders. It's not that they don't exist personality-wise, but they don't always get to commit that many crimes until or before they're caught. Sorry.
That's different than the US. Yeah.
And that particular item we want to make a footnote of too, Michael. That's one that's really not on the factor 1 or factor 2 structure. And some of my thoughts about those few items. What are there, Jason? Maybe 3 items that I look at those items differently. So, okay, so we'll remember that one in that regard.
Yeah. And I
So
think
what's
sometimes, I know this is the 70s, but you had a very good episode about Ted Bundy, which also
Yeah.
is a case that interests everyone who's interested in psychopathy. And the way that he could sort of move from state to state and
Yeah.
without getting caught, I mean, that doesn't exist in Denmark. You can go 500 kilometers, then you're at the other end of the country, and it's the
see?
same
Yeah.
system that you're registered in. So it's much more difficult to sort of hide here.
Yes.
Cool.
Yes.
And I would even say, in Europe, we've had people who fled to like the southern Europe, and they still get caught via Interpol, and so it's difficult to get away with stuff.
Which is one of the reasons a lot of things that may work in Denmark in various ways socially will not work in the US because it's a different culture and what you're
Definitely,
describing.
yeah,
When you can do that, you have more supervision, monitoring. The serial killer maybe does it one time, that's it, and they don't become a serial killer. I mean,
yeah.
this is a completely different world than the one we live in here. What was the? Oh, I'm sorry. Go ahead,
No,
Ron.
I just want to say that I think that I've seen psychopaths who had the potential to be serial killers, but the very efficient system that we have has maybe guaranteed that it didn't happen.
I may be
So,
moving to Denmark soon.
you'll be welcome, Carl.
This appeals to my obsessive compulsive, my OCD personality. Everything in order, things structured. I
Yeah.
love it. Well, what
Well,
was
I'm not gonna say that Denmark is perfect by any standards, but it is easier to manage a country of 6 million people than a country of 350 million people.
well, I do know when I taught in Denmark, with teaching the Rorschach over there, the one I taught in Finland and I taught in Denmark and then in Stockholm.
Hmm?
And Denmark, when I did my presentation there and told my jokes, everyone laughed and we had a great time.
Yeah.
In Stockholm, I told my jokes and no one smiled. So, I mean, it was the same presentation. I imagine my delivery was the same. So Denmark seems more appealing.
I think, Carl, you're preaching to the choir here because Denmark and Sweden are kind of arch rivals from many wars back in the
Yeah.
centuries, and we think they're boring, and we think we're much more fun. So I'm gonna agree with you on that one.
Shock data supports that as well, the differences. But
Yeah.
yeah, that was my experience.
Yeah.
Everyone was laughing, patting me on my back. We were ready to go have a good time.
Yeah.
In Stockholm, they never said anything when I did it. Then they came up and apologized. They were very nice people, but they said, Carl, we were afraid to ask questions because our English isn't that good.
Yeah. Maybe that's another thing. In Denmark, people tend to speak English pretty well because we learn it from an early age, and sometimes we kind of laugh about how the Swedes they speak English. But yeah, that's a different story. But I think I get your point.
Well, the next item, and you go over
Yeah.
another item that seems to differ as we
I
kind
think,
of build this case.
yeah. I think, like I said, on the more factor one items, I think the glibness is pretty much the one that intrigues me the most. That is a little bit rare. So if we go to say the ones about many what's it called in English that you live
Promiscuous
together.
sexual behavior.
No, the other one that's outside the factor structure. I only remember the Danish name. I have it here. Just a sec, Carl.
Criminal
Marriages
versatility.
or
The fact that you have many partners that you live with.
Short-term
relationships. Yeah.
Exactly, that's the one.
Yeah.
Sometimes I think that's a little bit different as well because maybe relates to what I said about the parasitic lifestyle, maybe not being as common. That people maybe not move around that much and tend to latch on to different women. It would typically be. So that could be also kind of a cultural difference, I think.
Well, say more about it. What would they tend to do there? What would you see there?
Sometimes, like I said, you can get kind of subsidies from the government at a whole other level than in the US regarding getting an apartment and getting financial help and things that maybe make it easier to survive by yourself. So you imagine the people who don't want to do anything to provide for themselves, they can kind of get a more of a handout in Denmark, and maybe they don't need to latch on to other people.
Well, see, in the U.S., one of the things I saw with one psychopath, at one period of time, over a 2-year period of time, he had 3 committed relationships. he would stay with one woman for 2 days. He would stay with another day 3 days, and then he'd go stay with this other lady on a weekend.
Yeah.
And
yeah.
he had clothes at each of the apartments.
Mm-hmm.
So technically, he kind of meets the criteria for being in those relationships.
Yeah.
And I think, Jason, you're going to find something different with the women that I think has to be included in that.
Yeah, the women, they tend to possibly stay in, abusive relationships, but then when you look at it, it doesn't, who's really the abuse? It seems like it's just as violent on both sides of things too.
Well, don't you even have to count then in institutional settings, they form relationships and create new families?
Yeah.
Actually, the prison I worked in back 10 years ago, and then for 10 years, we had a ward for female inmates, and then we had a lot of wards for male inmates, and they had kind of they could go out and take walks together, and obviously, you know what happens instantly, they become in relationships, and then they actually could visit each other inside the prison, and it was just I have to say chaos. So luckily, I mean, I think it was 5 or 7 years ago. That's the first time in Denmark, which is very common in other places, that we actually made a prison just for women, female inmates, and no males at all. Which I know, Jason, you will have a lot to say, can be its own challenge. But still, I think the way of coupling these, especially sex offenders and these female psychopaths, I mean, it was just not a good idea.
Yeah, that sounds really bad.
Well, now, what about the next item you had mentioned? I don't know if this was the last one, was the promiscuous sexual behavior, which is also not on the two-factor structures, which tends to indicate to me you can arrive at elements of that particular criteria for a lot of different reasons that may have little to do with psychopathy.
Yeah, exactly. And that's, as I said, you know, Denmark is a very liberated country sexually, probably one of the most liberated in the world. This goes from all the way back to when we released that the porn could be free, but also with like gay marriages and all this that we've been kind of front runners on. So we're very liberated. So we kind of tend to, and this goes for even for psychologists and psychiatrists, when we look at the item, we kind of laugh a little bit about, is this a little too Christian or too morally conditioned for us? Because we when we kind of look at, you know, how many people have I been with, how many people have other professionals been with during their lifetime, I think it differs. I do think so. Not a lot of people in Denmark will get to the age of 40 without having had a significant number of sexual relationships.
You know what I think about with that? Because the intent of the item isn't just the numbers. So let's say that you're scoring it in Denmark. Let's say everyone gets a 1. Well, people that aren't criminally oriented are still going to get a 6 on the entire scale. So we always want to watch as examiners when we're scoring this is begin to look at etiology and nitpick an item too much, because it can affect the score in ways that makes it less generalizable. Now, I had a schizophrenic patient years ago that I evaluated. He got a 2 on an item, but then he ended up getting like an 8 or 9 on the entire scale. So there is a danger in that. On the other hand, when I hear you talk, it seems like, okay, so everyone gets a 1. Almost the people that get 2 should be doing things where they're forcing people into sexual activity, or there should be another added element to get a 2. Because let's say,
I mean, some people come in and they honestly say they've had 200 sexual relations. I mean, that is a lot. I mean, that's not common in Denmark either. So that would obviously be a 2. But then I think there are 2 things that I always kind of look at. One is, as you say, Carl, if you have forced people into sexual relations like rape or other, and especially if you're convicted of that, I think it's almost automatically a 2. But also going to prostitutes, which in Denmark
is legal.
But it is a big discussion. Is it right to keep it legal, or should it be illegal? So it's on the border, you know. So that was, if people do that a lot, I tend to score them a 2 as well, because it's superficial sexual relations, you know, with money involved and all this. So
okay. So was there any other items, Michael, or was that kind of it?
I think those were the primary ones, but I want to what you said, Carl, got me thinking about. Sometimes I tend to we tend to kind of use the PCLR on some pedophiles, and they will exactly have a couple of scores where they might get a 2, and they might even get 5 of those, but they will rarely get over 15 altogether. So
See?
that's not an
Yeah.
ideal instrument for
Yeah.
use of.
Yeah, I used to do, Michael, a lot of training with the PCLR and all over the place. And over there in the Scandinavian countries, when I went over there talking, the biggest thing to get off track with scoring the PCLR is start nitpicking an item, nitpicking it. Because you look at one item like grandiosity, well, he's really schizophrenic, and you start doing these mental gymnastics, and pretty soon you're away from what Hare said the item criteria are. When you stick with the item and you stick with the criterion manual, you're going to come up with an accurate score, and the total score will differentiate. In other words, okay, say someone gets it. Yeah, go ahead.
I completely agree. And when you get the people who really score above 35, you're not in doubt. Different kinds of aspects of their personality and behavior will fit perfectly into different items, and then it really makes sense, and that's when the instrument is really helpful.
Well, Jason, Michael and I are kind of on a roll here. We're not letting you get in. Did you have anything to add?
No, you guys are pretty much covering it. I did want to ask Michael, did you want to, so we kind of talked about obviously Denmark, but you've also assessed people over in Greenland as well. Would you say psychopathy, we kind of, obviously 1% of the US, probably could be diagnosed with psychopathy. I would imagine it would be less in Denmark, but anything in terms of Greenland and psychopathy when you were over there?
Yeah, well, I don't think there are any studies that I can sort of convey, but my experience from working with people in Greenland, that this goes back 20 years as well, is that there are not more psychopaths in Greenland than in Denmark, but there is probably a higher number of personality disorders and also antisocial personality disorders. There is a theory about this actually, because as you know, Denmark has kind of colonized Greenland 300 years ago. And then for many years, it was what it was. But then in the 1950s, 1960s, there was a real force in Denmark that says we need to get these people to be more of a civilized nation, not just fishermen and hunting people. So they built kind of concrete buildings and stuffed them into small apartments, and they started working in factories instead of providing for themselves, and this kind of became very problematic, because then when there wasn't any work, people started drinking and they didn't know what to do with themselves. So I think it's not to put any blame on Denmark as per se, but there's a theory that that's why kind of things have snowballed a little up there, that they were forced into a lifestyle that's not maybe natural for them.
Well, we're not going to talk about it now, but this sounds like this is going to have links to when you tell us about your work with sex offenders.
Yeah,
there.
Definitely.
So that's a good backdrop to that.
Yeah.
Well, now we get to this point because, one of the frustrations I've had in looking at the literature that comes out of academic settings is they don't seem to be concerned with the generalizability of the findings, and they come up with all these, what I call counterintuitive kind of findings they fly in the face of good research that's been done for 50 years. And one of the things they do is they push for the lowering the cutoff score to make a designation of psychopathy, or a character to create a category of psychopathy. In other words, if you have everybody across the board that's 30, you can say psychopaths are like this, psychopaths are like this. You can compare, but they begin to drop and they push for lowering the score. And of course, we'll get your thoughts and Jason's, but my thoughts, particularly after even talking to you more, with realizing, why do you want to lower a cutoff and create psychopathy where it doesn't exist? Because now my thought is many of the cultures like Denmark have less psychopathy. So why would you lower the score just because you're not getting a lot of people above it? Maybe the PCLR is accurate in assessing the psychopathy level. So what are your thoughts?
I'm pretty much on the same page as you, Carl, and I think it has to do with researchers in Europe kind of maybe wanting to or trying to find out, well, US and Europe is not that different, so maybe why aren't we getting the kind of same results here? And then maybe they manipulate, or well, that's a big word, but they change the cutoff to kind of reach the same maybe percentage of 1% of the population or whatever. I'm just thinking out loud here because I
Yeah.
honestly don't know. When I ask other people, why do we use this? Typically, people use 27, but that's 3 points. I mean, that's a big change. And it has to do with, as you said, some of David Cook's research on psychopathy in Europe. But yeah,
Yeah,
as I said, I'm pretty critical of it myself.
Yeah, because here's what they do here in the US. They'll lower these scores and stuff, and they do it because they're not working in environments where there's a lot of psychopaths. So they can opine about psychopathy and offer their lofty, sometimes arrogant opinions. They got to get psychopaths in their studies, so they fudge the research methodology. Now, there's a difference between a cutoff for wanting to designate someone a psychopath to discuss their differences and lowering the cutoff clinically for predicting risk. When you lower the cutoff for predicting risk in an outpatient setting with no structure, someone that has a 15 on the scale, if many of those items have to do with factor one, are going to be a problem in your program. So
Exactly.
they seems to mix up the clinical usage with the research usage and designating psychopathy to compare the characteristics of the individuals. Clinically, you can pick any cutoff you want that may fit your particular setting. So
And I also just I think I always teach young psychologists when I talk to them about the PCLR is what Hare has always said. You know, it is the complete construct of it that is psychopathy. So there is no you know, on my watch there's no writing they have psychopathic traits if they score like 15. Because no, they have maybe some deviant traits. They have some traits that might be linked to other personality disorders, but it's not psychopathy.
there
So
you
you can't
go.
say, for example, that is what you mean also by nitpicking on one item, that because they are very promiscuous or very glib, that they are kind of psychopaths. It doesn't really
No,
make sense.
they could have another personality disorder, or their scale could be so low, but it has nothing to do with psychopathy.
No.
So now I guess we see eye to eye. I don't know, Jason, if you're going to weigh in on that at all.
Well, obviously with the women, all the research, they drop it down to 25 and, compare it and things like that. And I know there's this Canadian researcher, academic guy that's going around talking about how like psychopathy doesn't exist or the
Oh
research
boy.
doesn't pull it out. But I'm going to say it's probably has to do with poor research studies of dropping down the scores and stuff. Like they probably don't have any psychopaths in their sample, and that's probably why some of the research isn't coming out. So yeah, so obviously it's a problem. It would be better 30, but if you don't have any people that hit 30, then maybe you shouldn't publish the research, but they drop it
Yeah,
down and try
you're
to
not
get it
talking
published.
about
Jason, can I
psychopaths.
ask something? Do you think
Yeah.
it's because that they want it to be called psychopathy because you could study it in a number of ways and call it whatever you want, but is it kind of that they want to be on that same kind of discussion topic about psychopathy because it has a ring to it or whatever?
Yeah.
Yeah,
I think that could be,
and
that could be, it's just
and
antisocial personality disorder. Yeah.
you're being nice, Michael. It's because in their arrogance or narcissism, they want to opine on a subject that they don't have any experience with. So I'm being more direct, but yes, they want to weigh in. It's like everyone wants to be an expert on
Yeah.
the Rorschach.
Yeah.
So you see all these people talking about that don't know anything about it. It's the same with psychopathy for some reason. For
I
some
think
reason,
it's way worse with psychopathy because that is, people will in the street if somebody drives by them too close on their bike,
yeah,
they'll yell, "Oh, you psychopath!" So that's just the people use that word in all kinds of meanings.
that's what it leads to. It leads to that kind of thing. And even if people don't kind of follow what we're saying, they can think about it that whenever you lower the score from a 25, let's say, to a 35, there must be some mathematical, geometric kind of ways you can arrive at a score 25 versus there's much less
Yeah.
to arrive at a score of 30 or 35. And so you can't do it because you create a much more heterogeneous group.
Yeah.
If
I think
if
you
we
have a
if
little bit of the same problem with the schizotypical which is in DSM is obviously a personality pathology, but in the ICD-10 and 11, which we use here, it's more of an F20, like a schizophrenic spectrum thing. Is that there are so many ways you can be schizotypical that it almost doesn't make sense if I'm a little a little rude here.
Well, yeah. And then when you get up, the higher you get to a more homogeneous group, like you elevate the scale rather than lower it, rather than 30, go up to 35. And you get the people all above 35, they're going to have a lot of similarities.
Exactly.
So, I guess our conclusions is the PCLR is good where it's at in terms of males. Well, the females is another story.
Are different. Yes.
That there definitely is some cultural differences that need to be taken into account. But once you start getting pretty high on the PCLR, things kind of get very similar across cultures. And there's probably no need to drop the cutoff score, especially if you're doing research or really just talking about some of that's higher in psychopathy and things like that.
Because the groups you then compare, Jason, are not comparable. You can't call them psychopaths. And culturally, you don't want to lower the score to create more psychopaths because they're not there. You have to entertain the most obvious kind of conclusion that maybe Denmark has less psychopathy.
Yeah.
Which
I
probably
I would go for that one. And I think it's the same as if everybody who commits a sexual crime against a child, you call them all pedophiles, then you miss what pedophilia is. Exactly, just like if people throw a bottle at a police officer, then they're not terrorists. Terrorism is about overturning a government or a state or something. I mean, it's just I really don't like when you try to use the terms in ways that kind of water them down into nothing. So it goes for a lot of different terms.
I ask a final question. Jason's concluding it, but do the psychopaths over there look the same on the Rorschach as the psychopath over here?
I think we have some pretty interesting topic there, an interesting topic for a whole podcast.
Okay.
One of the things that's so fascinating is that when you read about comparing, for example, Ted Bundy and Charles Manson, as you did. I mean, they can still look very different on the Rorschach, which just goes to show that has a whole other level of uniqueness. But yeah, obviously, and I really enjoy the fact that in the new, I use the CS and the CSR. That's just my preferred system. That the aggressive scores is really getting the place that they deserve to have in the aggression cluster on the CSR. I really like that.
By the way, those are the only valid systems for using the Rorschach.
Yeah. I agree, but I don't. That's another discussion for another day. But I really enjoy the CS and the CSR. So obviously, I agree with.
Well, Exner's structural summary was a work of art. As a fellow artist, when you look at that, and you can look at that one structural summary, and you can talk all about the person on and describe every aspect, and it's so easy to read. He was an artist.
Magnificent test to work with. I mean, it's just. I mean, and people who don't get that, it's because they don't know what it is. I mean, whenever you teach it, which I do a lot, people say, "Okay, now I understand why it is so fascinating."
Yes. Well, Jason better rein us in.
Yeah. Well, guys, thank you again for tuning in, and thank you, Michael and Carl, for your insights. So again, thank you everybody for listening and watching. Feel free to like and subscribe on YouTube or wherever you get your podcasts, including Spotify and Apple Music. Check in again for our next episode, and we'll see you and talk to you then.